Well, Marissa, thanks so much for joining us today. And we are really looking forward to some of your insights, both from how you frame leadership skill sets and really getting the work done, as well as what was that work and what are the policy insights that you have for us. And so before we get started, I would love for you to give a little bit of introduction to yourself and your role and what that encompasses. Obviously, you're the Deputy Commissioner at New Hampshire Health and Human Services, but what does that role look like in New Hampshire?
DHHS in New Hampshire is a super agency, meaning that all the different parts of the health and human service ecosystem, Medicaid, public health, behavioral health, child welfare, all roll up to one point. And I'm super fortunate to be part of this agency. We're the largest agency by a lot, both in terms of staff and budget in the state. And as I like to remind staff at orientation, there's virtually no person in the state whom we don't touch in some way. So we take that responsibility really seriously. And my role is largely around strategy for the agency. So looking at some of the challenges and opportunities we have, especially when it comes to knitting problem solving across different parts of the agency, so that if we have a behavioral health problem, but it also impacts childcare and Medicaid, that we're looking for those and leveraging those intersections.
Great. Thanks for that. And one of the things that I have really enjoyed about getting to know you better through the Fellows Program is your leadership style. And you've taught me quite a lot about leadership, adaptive leadership. But I'm wondering if you can start us off by maybe defining what adaptive leadership means to you and ways that you've seen that play out in your role.
Yeah, thanks. So Ron Heifetz is often seen as the very much the father of adaptive leadership, and I was fortunate to benefit. I never had Ron as or I should say, Dr. Heifetz as a professor, but in my graduate studies, worked with lots of people who work with him, and so. What I learned there and what has become very much a guiding principle of my leadership is this notion of adaptive leadership, which is the practice of mobilizing people to solve problems that really can't be fixed by expertise or authority on its own. These are problems that require major changes in behavior, relationships, and in shared responsibility. So I often joke that the best adaptive leadership exercise in my life right now is parenting a 4-year-old. And so when it comes last night to trying, after several unsuccessful attempts to get her to take a bath, I suddenly realized, and my husband realized, that maybe the way we were approaching this was a little technical in nature. That what was being resisted with tremendous amount of tantrums and continued filth accruing was really that what my daughter wanted was control and was being able to be the leader of the family when it came to deciding when and how she would take a bath. So I enjoy these examples because it's really about how do we even define what the problem is in the first place. So there's kind of three parts, I'll just say, to how I break down the principles of adaptive leadership. One is distinguishing between what is a technical problem from what is an adaptive problem. So in the case of the 4-year-old who won't take a bath, it's seeing it as simply she's not complying with my instructions. She's filthy. She needs to get into the bath, before it gets too late. When in reality, upon further analysis, we discovered that actually this is a complete demonstration of her ability to control and manage the family herself. The second principle of adaptive leadership is getting people to do the work of adaptation. So when you're leading adaptive problem solving, you aren't just telling people in a command and control way what to do, you're mobilizing the system to solve that problem. So it means pushing the work back onto people and on teams, and sort of resisting the urge to rescue. So once again, we'll use our 4-year-old bath example. I think here it was really about helping my daughter to feel empowered in designing how the evening would unfold according to her wishes. We also tweaked some of the context in terms of our timing last night and our some of the perks and toys and other opportunities that were offered, but really putting her in control of how this was going to go, the various steps to the process, the flavor of the popsicles that would be enjoyed during the bath, and so forth. And so, really putting the work back on her. The third principle of adaptive leadership is resisting distress. I'm sorry, regulating distress so that
Yeah.
folks don't feel overwhelmed. So, in an adaptive problem solving, you need a certain amount of discomfort and sort of heat, but you also need to create a holding environment that isn't so intense that folks can't engage. And so it's really about motivating that learning, motivating that engagement, but also holding on to the fact that this is, a bit of this comes with a sense of loss and oftentimes a sense of pain for people. And so to use our fun example, I think what I realized with my daughter is that we needed a little bit of pressure. Like we needed to set a goal as a family for where we were going to get from filthy child to clean, pajamaed child. But we also needed to sort of lower the temperature and make sure that that goal was imbued with a sense of fun, with a little bit of
Mm.
respect that she was going to have to come along with us and so forth. And so I think Heifetz refers to it as sort of the zone of productive equilibrium. So just enough pressure to kind of allow the learning and the change to happen, not so much that people just get overwhelmed and disconnect.
Yeah.
So that's my that's my
I love it.
parenting example of adaptive leadership, and I'm happy to give more professional examples if you'd like.
Well, I think that's fantastic. And I appreciate the way that you've really broken that down into three main areas, that defining the problem, and then get mobilizing the system and or the people to do the work, resisting, I love how you phrase that, the urge to rescue, and then regulating the level of distress. I think that really those three things, there's obviously a lot of tools within each of those three things, but that's a very concise way to frame it. Just thinking about that first one, the really defining the problem. Can you tell us what have been the tricky problems that you've been trying to wrap your brain around?
Yeah. So one of I'd say the first time I ever kind of really deployed like an adaptive leadership approach with intention and with some of the training, I was actually on the issue of suicide, and it was before I was here in the state of New Hampshire, although it's ended up continuing to be an important focus. So to boil it down, essentially, I was asked to come out to the state of Utah during my graduate studies to help bring some of the tools and science of public health to this growing problem of suicide. Utah is one of the highest suicide rates in the country, and a lot of efforts at expanding mental health treatment didn't seem to be moving the dial. What we found when we went deep into the data, into what was actually happening and analyzing death certificates and understanding the context for these tragic events, was that the issue of suicide in Utah was being misdiagnosed as a mental health gap. There's no question that people who are in suicidal crisis, people certainly need mental health treatment, and there's lots of reasons to expand mental health access. But in this particular population health situation, the reason Utah had such a high rate of suicides was the issue of access to firearms. Utah was no more depressed than other states within Utah. Counties with higher rates of suicide didn't have higher rates of depression, anxiety, or other psychopathology. What they had was ready access to a very lethal means of suicide in a moment of crisis that had a very high case fatality ratio. So essentially, we discovered that over months and involving lots of different teams, we discovered that was what the main driver was. And so we had to go through that process of diagnosis from technical to adaptive. The second was, what do you do about that? So the mobilizing teams. And what we fortunately realized, thanks to some great pioneers in this space, was that public health type people kind of lecturing families about, you need to reduce access to guns, you need to lock up your guns, was never going to work, especially in a state like Utah that has more than half of homes, oftentimes 75% of homes, especially in such a rural state, have at least one and often many more guns. It's part of the life, or it's part of the culture of the state, part of the tapestry of that state. And so the messengers we needed to partner with were actually gun owning families themselves. So by engaging with leaders in the gun community and the Second Amendment community, all of whom were deeply concerned about the issue of suicide because they were so disproportionately affected, we were able to come together and in non-regulatory ways, working with legislators like Steve Ellison, another Milbank fellow, and working with other health and gun owning communities, craft solutions that very much built on values that gun owners already held dear of families supporting their loved ones, neighbors helping neighbors. And so solutions like having a friend babysit your guns when you're going through a tough divorce or a recent job loss, and instituting other social norms, opportunities, turned out to have a tremendous amount of interest. And again, by having those messages and ideas be generated and conveyed by the right messengers, we were able to get quite significant take up. So we're replicating a lot of that in New Hampshire. New Hampshire actually had some of the origins of the work that we took on in Utah, but I think ultimately it was not without tension. Again, it's not necessarily comfortable for a gun owner to come to a public health meeting where data is being presented and people are talking about p-values and relative risk and so forth. Nor was it comfortable for me to go to shooting ranges and gun shops to talk about an issue that I sort of understood more academically. But by each giving up a little bit of our sense of comfort, we were able to recognize that we had a tremendous amount of curiosity about one another and a huge desire to achieve the same goal, which is that no person in suicidal crisis should have access to a gun. So I've been so honored and proud of how that work has continued in Utah and in states like New Hampshire, as well as across the country, but very much would have never been able to be part of that journey if we hadn't gotten the definition of the problem right in the first place. Again, lots of reasons to expand mental health access in this country. Um, Doing so would have been a very ill-equipped solution to the problem of suicide in Utah.
Mm. That's a great example in the sense of you having a shared sense of the problem, and not going in with pre-baked solutions. So you're not going in advocating for a solution. You're really looking for a new solution together, but to be able to do that, you've got to build trust amongst different stakeholders that do want the same outcome.
Totally. And I think that, I mean, the humility, adaptive leadership requires such a huge amount of humility,
Mm.
which by acknowledging that we have to experiment and work differently together, that humility makes people really lean in new ways. So it's premised on the idea that our traditional forms of authority and expertise are inadequate to solve the most complex problems. So already you're sort of putting people at ease or recognizing that, you know what, we've kind of failed at this problem and at solving this problem. And so I think what I've noticed is the humility that it requires tends to those teams that are willing to go there and that are willing to experiment and really look at the problem anew, attract really interesting bedfellows
Mm.
because they're demonstrating a level of openness and a willingness to trust. So that kind of becomes like the soul of the work moving forward. And I think what was exciting for me coming into the Milbank Fellows program was realizing that some of this work could happen in state government, that even with some of the constraints of politics and bureaucracy, that there actually was tremendous room for creative problem solving in a way I hadn't expected. And I think that's turned out to be such a valid or such an accurate opportunity. And again, being able to talk with other people in the Milbank community about how they are diagnosing a problem or how they are building the container to experiment and build coalitions around things has really allowed this to be a blueprint in my day-to-day leadership at DHHS.
Yeah, and I appreciate you've had that multi-state experience, and you're still learning, obviously, from multi-states. And obviously that work in Utah has continued with a number of pieces of very well-supported legislation and programmatic interventions that have resulted in a decrease in suicide. And I know we've captured that some with some conversations with Steve, and obviously with you. And I'd love to pivot a little bit to talk a little bit about your work in New Hampshire and how you carried these principles into particularly the behavioral health and ED boarding problems that are not unique to New Hampshire by any means, but you guys have similarly applied some of these tools to those situations. Wondering if you can tell us a little bit about that.
Yeah, so when I arrived in New Hampshire, my original role was as an associate commissioner overseeing a number of different areas, including behavioral health for the state.
Mhm.
And one of the largest crises at the time was the issue of emergency department boarding or ED boarding of people with psychiatric needs. And so the issue here is people who are experiencing a behavioral health crisis aren't sure where to go or don't have places to go. So they go to the place that's open, which is an emergency department. And oftentimes the emergency department may determine that that person isn't safe to go home, but doesn't have somewhere else for them to go. And so historically, this issue had largely been seen as an issue of lack of behavioral health inpatient beds. So that was sort of the problem definition when I came in. And I should mention, when I say crisis, I mean, first and foremost, a huge challenge for patients and families. So we're
Absolutely.
talking every day in a small state like New Hampshire, 50, 70 patients on their darkest day um, in hallways, in rooms that were not designed for them, in fluorescent lit waiting rooms, and not just for one day, but for days, for weeks,
Oh,
waiting for care, which is could not you could not describe a less therapeutic
right.
environment or a more scary scenario for their families. Not to mention all the disruption and challenges that that creates for other patients and healthcare providers. So that was one thing, was like just the problem as defined and experienced by people with mental health issues. The other issue was that the state Department of Health and Human Services had had lost a major lawsuit related to this, brought by a number of different plaintiffs, but really led by the hospitals in New Hampshire, who were very frustrated and tired of having these patients lined up in their emergency department. So by the time I arrived, a judicial injunction had already come down saying, State of New Hampshire, Department of Health and Human Services, you need to solve this, and we're going to give you 12 months to do it. So emotions were extremely high, time was limited, and the frustration was already at a boiling point.
Mhm.
So I think what we were able to do was very much kind of the adaptive leadership moment of saying, okay, we're in this crisis. How have we even defined the problem first and foremost? And as I
Yeah.
said before, really it had been seen as lack of beds. So during COVID, and prior to COVID, we had built beds, but again, those tended to get filled up with patients who again were and not necessarily contribute to kind of real solutions. So what we started looking at was what were some of the other possible drivers. Long story short, as a department, we determined that the issue of beds was in some ways secondary to the issue of some of the upstream drivers, meaning people don't have other places to go. So folks were having issues getting outpatient appointments. They were not knowing where to go to get their meds regulated. So there was a whole front door problem.
Whole
Um,
ecosystem.
yeah, the second issue that hadn't really been named in the beds problem definition was how hospital emergency department social workers were going about finding beds was about
Mhm.
as fragmented as you can imagine.
Mhm.
So the way it was working was hospital social workers at all 12 New Hampshire hospitals were each calling hospitals with inpatient psych beds every day saying, can you take this patient? Can you take this patient? Can you take this patient? So multiply that times 12. So the phones were just ringing. That was the strategy.
Mhm.
So irrespective of the number of beds, there was no coherent way for actually navigating that. And then third, there was an issue of the backdoor problem, which is, as I sort of alluded to before, patients were getting into beds, but then many of these patients had other issues like medical frailty or disabilities. So once they got psychiatrically stable, they weren't discharging. So we had lots and lots and lots of beds filling up with patients who now had their mental health needs met, but had nowhere to live, nowhere to go. So what we did is we looked at those three drivers, the front door, inpatient coordination, and back door, and looked in the literature, looked at other states. What are basically the things that have made a difference? And we examined about 30 initiatives. We came up with six. And then the second thing was really convening that team to work together differently and to take that adaptive leap. Again, we knew that DHHS, who had just lost a lawsuit and received a court injunction, wasn't didn't have the most trust in the community or
Sure.
sense of being the problem solver. So we ended up doing something kind of rogue, which was we approached the very hospitals who sued us through their association, and we said, "Will you partner and basically create a coalition?" NAMI New Hampshire became the broker, like the physical
Mm,
place and holder of that space, which was really important, by the way, because it helped us keep at our center not a focus on pointing fingers and
yeah.
how things had played out in court, but a real focus on families and on people we were serving.
Yeah.
So the Hospital Association, NAMI New Hampshire, DHHS came together. We had a steering committee, very intentionally crafted, that included, again, folks with lived experience, included the community mental health system, clinical experts. And we said, here's the six things. We tweaked them a little bit based on feedback. And then we said, well, can we do this together? And so I'd say, intentionally made a very concrete decision to go about it in a way that was collaborative. We built dashboards to be very data driven, to measure progress over time, a lot of focus on public transparency. And the response was tremendous. Not only did we find ways of advancing those initiatives together in a way that has dramatically changed the situation in New Hampshire, we now regularly hit zero on our wait list on any given day, that we've dropped the wait time by over a third. I
Wow.
mean, we haven't eliminated the problem, but it is a completely different situation in this state. We're now taking on even bigger ambitions around Mission Zero. But by doing this kind of experimentation and showing the humility that we needed one another in order to advance it really made a huge, huge difference. And again, that like zone of productive disequilibrium, like it
Yeah.
wasn't easy sitting at the table the first day. There were still very high temperatures, a lot of distrust. But I think the crisis had reached such a point and people were so tired of fighting with one another
Mm,
that having NAMI as our convener and having this patient-centered, data-driven view, I think folks said, "What do we have to lose?" And so it's been a remarkable effort that the legislature, even in a state like New Hampshire that doesn't like to spend money on most things, has responded to. We gave it a really good name called Mission Zero. And it's not without challenges, especially in this uncertain time, but it's basically allowed us to build a brand, build a reputation for problem solving that continues to pay dividends beyond even ED boarding. So I think that's one of the ones that has been most astonishing and encouraging to be part of here in the state. And like I said, the beauty of adaptive leadership is it just kind of like it just grows. So then the ideas continue to flourish around, where else can we bring this, and
mhm.
what other health and social service problems have we been misdiagnosing historically?
Yeah, what a great example. And I think kind of the skills of like how do you turn down the temperature? A lot of things feel like they are boiling over. Like there is no zone, like it's a boiling pot of disequilibrium, not a zone of productive disequilibrium. And so that skill of bringing in a third party that like it doesn't have to be you that turns down the temperature, but handing it to somebody else, and really kind of making it everybody else's. Like that's a very it's a very difficult thing to do, to have people own the problem when they feel like you're the cause of the problem. Um,
And having that clear goal too, I think it's so simple. I mean, this is like communications 101, but so often with these complex problems, we feel like the more complex the problem, the more wordy and abstract the goal needs to become. And it's really the opposite. It's when things get most complex that we have to discipline ourselves as leaders and teams to say, what is the most cogent, simple, easy way to describe what we're aiming for? In the case
Mm,
of the suicide guns, it was no person in suicidal crisis should ever have access to a firearm. That is something I would say, that's something the head of the gun advocacy group would say. It was like super simple. In the case of Mission Zero, no person in psychiatric crisis should be waiting in an emergency department for care.
mm.
Period. I mean, it's just like that is sort of describing the vision and what we're aiming for. And it brings people along because we may have a lot of opinions and opportunity for debate and around how to get there. But if you don't set that clear unifying goal, it's very hard to even begin talking about the how.
Yeah. And so obviously, even finding creative solutions and new solutions that you certainly didn't see walking into these problems, that continues to evolve, and the problems continue to evolve. Systems get more complex. People are always changing. Technology is always changing. How do you keep a focus on the work at hand when it seems like, we solved that problem. Let's move on to the next one.
Yeah. Well, I think this notion of continuous learning
Mm,
is fortunately baked into adaptive leadership at its core. So, in his different lectures and articles, Ron Heifetz essentially says, and I'm paraphrasing, but you have to be willing to try new things to see what happens to make corrections. So I think in adaptive leadership, you're constantly treating the initiatives you're undertaking as experiments, not necessarily as fixed solutions, which doesn't mean you don't take them on with significant rigor. It
yeah.
just means that you have to, as Malcolm Gladwell recently said, like hold loosely to your best ideas. Like believe in it, put everything into it, but also be super open to the types of insights and learnings you're going to gain as you go. So I think adaptation and learning is very much at the heart of how you set off on an adaptive leadership journey. And it's this kind of, again, it's not that you're willy-nilly trying things left and right. It doesn't mean that there's constant change. It means we're going to be very intentional, very disciplined about how we adapt based on shared reflection, based on evidence, but anchor to this core purpose the whole time.
Mm,
And that's hard for people to get used to because I think, again, in situations of complexity and urgency, we want to like find the solution and then just like totally put on our tunnel vision and go and solve. But unfortunately, the world we're living in is one of constant change. So even if your solution was perfect for that moment, what is happening around you is going to evolve. And so with Mission Zero, we had tremendous success in 2 years driving down ED boarding, building
right.
trust among hospitals and players and state. Now we have this new reality of all the changes that are coming to Medicaid. Now we
Yeah.
have new reality of all the financial pressures on hospitals. Now we have a new reality of a housing crisis that has reached even more epic proportions. In that situation, it's not okay to just say like we're going to keep doing the same menu of things because once upon a time that was what we thought about. And I think that's we had a big steering committee meeting the other day, and we're like, how like if we don't do anything, we're basically going to backslide. So it's that constant evolution that is very much baked into the philosophy, but I think it's one of the hardest ones for people to get is like you not only have to re-diagnose, now you need to, as Heifetz says, get up on the balcony and continuously monitor what's happening on the dance floor and not grow so attached to your solution that you aren't willing to shift it when conditions change. So
Yeah.
that's hard work.
Yeah, oh, it absolutely is. And it's interesting to use that getting up on the balcony analogy. Often in a sense of monitoring the ongoing situation, often we see that like I need to get to a 30,000 foot view so that then I can figure out like what the real problem is. So you kind of use that skill in all three of those buckets that you
Yeah, that's a
described.
great point. I
Yeah.
think that there's like no phrase that I annoy our teams and my staff with more than the balcony and the dance floor. I'm shocked I haven't, I'm shocked it took me so long to get into it in this conversation, but you're totally right. Like from the point of diagnosis to the bringing together of the team to the reevaluating, like all of that is both like getting up high and getting low, getting up high, getting up low. So often I think we get stuck and comfortable in one or the other. And I
Yeah.
think that is like one of the most valuable metaphors that's brought to bear. Another metaphor, by the way, that I overuse is like the hearts and minds piece. And I think this is another area that Milbank has really helped me develop and believe in deeply, which is the work of adaptive leadership cannot just be the work of logic and data. It certainly needs to be those things. But in order to approach problems and people differently, it has to be a hearts and minds approach. Heifetz says like the approach needs to be above and below the neck. And
Mhm.
I think that work of building relationship, of admitting when you don't know something, of holding a sense of loss for people
Mhm.
who may have been trying something for a very long time with great commitment and passion that simply like wasn't working. Like all of that relational dynamic requires engaging with one's heart as well. So this
Mhm.
is what makes it hard. It's like it's
Yeah.
not this is not something that you can just like learn in a course. You have to have supportive mechanisms and community with whom to reflect on. And I think that's where Milbank Fellows is really special because we can engage regularly with others and sort of restore ourselves from what can be some very exhausting, intense cycles of problem solving. It's not all smooth and exciting. It's there's a lot of dark days too.
Oh, absolutely. And I think that kind of leads into another question of building like a culture of adaptive leadership. And part of the element of adaptive leadership is that everyone leads. It's not the leader or the leadership. It's everyone that's leading. But that is a real culture change, again, to kind of invest people with the tools, and with the trust, and give them a space to be reflective in that capacity. Can you talk a little bit about how you've built culture to build a team to do this adaptive work?
Yeah, I mean, I think it's such an ongoing experiment. I think I feel so blessed to have been to sort of come of age as an early leader at a time that many of these ideas, whether it's Brene Brown or Ron Heifetz or some of the other like thinkers in the space are really helping give us like a language for how to describe this. But ultimately, adaptive leadership states exactly as you put it, that leadership is a verb. It's very much anyone at any level can exercise leadership. And so here at DHHS, what I often try to do, and on it, it's very selfish. It's sort of for my own wellspring of optimism and hope each day. But I really try to look for opportunities where I see people who don't necessarily identify as like authority leaders exercising leadership and give them shout outs and like celebrate and lift up that work. So an example might be like we've had like most states, we're in the midst of this wild sprint and marathon of the legislative session and tuning in to watch how our teams are giving testimony and bringing science to the fore. And some of the people who are doing this are like epidemiologists and policy analysts. These are not people who necessarily have been on the public stage before. And the ways in which they are sharing information, taking questions, modulating sort of the temperature in the room is such an exercise and masterclass in leadership. And so acknowledging those efforts, celebrating those efforts, even if it's on a bill that we know is going to be kind of terrible for families and kids, like we need to celebrate the process of building that muscle as a team. And I think the recognition of it. We have a roadmap right now, which is our strategic plan for the department. The number one piece is investing in people and culture. One of the biggest ways we do that is by helping people find meaning in their work and feel that they themselves are empowered, no matter what level of experience or what level of the organization they work at, to be change makers. And so I think that's part of the culture is sort of like shifting from a top-down mentality of leadership to very much honoring the expertise and the ways that people are showing up in dynamic capacities.
Yeah. Um, Super helpful in how you frame that and those specific examples. One more question for you, and then we'll wrap up. Thinking about the day that we live in, right? I think a lot of people might have hesitation about a leadership model. And sure, there are a lot of different leadership models that you can adapt in different ways, or use in different ways. Um, and the day that we're living in now is obviously really different than when this model was initially developed, a couple decades ago, even though it's been practiced in a number of different environments, thousands of different environments across the world, across time. Um, what would you say, like, how do you think about the moment of time that we are in now, particularly in state agencies, state legislatures, the constant flood of information coming from different directions, the constant pressures of changing programs, of big pieces of federal legislation that have to be implemented at the state level, few resources, budget demands that are really unprecedented from what we've seen. How does this model hold up? How are you using it in a time that feels like indeed constant change, and where it's hard to have a priority and everything has to be the priority, or there's tremendous consequences down the road?
I feel like this is sort of the era of not knowing, of just having no clue what is going to come next, and sometimes what's even upon us.
Mhm.
And in my experience, the leadership philosophies and principles that most resonate with me honor that not knowing and treat it as an expectation and something not to be ashamed of, something not to resist against, but to flow with. And so, I think some of the elements I mean, trust is sort of the hardest thing to I'd say the volume of trust feels very low in public officials. On the other hand, what I see happening every day at the legislature and in our cross-agency activities are allies coming together in really interesting ways. So with childcare, we have the business community and we have childcare providers and leaders. I was just in a meeting this morning who many of whom were kind of like at odds, but now are teaming up to say how can we really frame childcare as a key social need and as a key driver of family mental well-being and mental health. I think we see a lot of like creative um, partnerships blossoming in the trenches, and so I think those partnerships are only possible if you're actually open to them, meaning like actually willing to try something new, but also not so burned out that your head is focused only on a screen or focused down on the crisis in front of you. So for me, I think the relational piece, even if it's one of like commiseration and bleakness, like texts with fellow Milbank fellows who are deep in it, or ideas or humor, like that sense of human connection is like deeply, deeply invigorating. And I think the times we're in both necessitate it, but also become kind of like a moment of connection for us. So I think that's been one of the I won't call it a silver lining, but just understanding that you're not alone in this and that it sort of feels okay to say I have no clue what is going to happen with work requirements because of X, Y, or Z. I sometimes think like 3 or 4 years ago it might not have been safe to say that, but because things have reached such a climax, we're willing to let our guard down, willing to let our traditional egos and sense of authority reduce a little bit and come together to say, this is really hard. And what sense of agency can I find? Generally, it's a sense of agency that comes from connection and from sharing with other people, not just buckling down. So I think there is like a level of creativity in crisis that we're seeing. And it's not to say that I would wish this time upon any leader, but I do think it's forcing us to be open and vulnerable and connected in ways that are quite meaningful and positive.
Yeah, absolutely. For such a time as this, and you know, and back at you in the sense of, for such a time as this. I'm so thankful for your leadership in New Hampshire, your willingness to share that across obviously New Hampshire, but the rest of the country, and to other leaders who similarly find themselves in unprecedented times, in times of crisis, trying to see that window of opportunity, trying to bring bring people alongside, both as a for my own self, but also for them. There is a lot of strength in this community, and in the skills that you bring to it. And so thank you for that. I am really looking forward to the great work in New Hampshire. You guys have monumental tasks in front of you, and it's going to be fun to learn how you climb those mountains,
Thank you.
literally and figuratively, and get your
No.
kids a bath at the same time.
Yeah, yeah. Occasionally bathing a very dirty 4-year old. Yeah, no, right back at you. And I think again, thank you for kind of creating a space for us to build that sense of connection and sense of it being okay to feel lost in the darkness at times. I like to say that the Milbank Fellows program and emerging leaders are the Gatorade of state government, that you really keep our electrolytes balanced. You keep us like chugging along by helping us feel less alone. And that's what builds endurance over the long haul, is that even if this work is hard and frustrating and bleak, we're building meaning. We're finding a sense of purpose through the challenges of it all. So thank you guys.
Absolutely. Well, thanks, Marissa.
Okay.
All right.
All right.